Jacob Spellis with Vital Health, and today's video will be on general anxiety disorder. As a licensed therapist, I see a lot of people coming into our agency with a lot of stressors, and I want to break down the difference between general anxiety disorder and just regular stress. So, before somebody gets general anxiety disorder, which is a terrible condition to have, it can lead to, I see patients, some of the most severe cases I have, I remember being in the hospital one time, and a gentleman, he wasn't on drugs or anything. He was just scratching himself real bad, and I ran to the psychiatrist, and I was like, doctor, this guy's scratching. I thought he had a medical condition, and he's like, I've seen a bunch of psych doctors, and he had bugs. So first, I've seen histories of meth, no histories of meth, and he was scratching himself, and the doctor's like, yeah, he's like, very interesting case. I've only seen 2 in my career. And anxiety was so bad that he rated himself till he got to the hospital. I forgot the term, terrible social worker, but I was shocked that anxiety led to that much scratching, and to the point where like psychiatrists in the local area couldn't figure out what's going on. He had to be heavily medicated, and it was sad to see. And see people have hives on their neck, hives on their chest. Point to panic attacks. We run blood work on patients here at Vital Health to the point where inflammation is so bad that no medical condition can make sense of what's going on. So general anxiety disorder can lead to many things, to the point where people feel like they're breathing so bad that they're having a heart attack. We have patients that come here that are in the ERs 2 to 3 times a week, to the point where we get them, maybe stable, where they don't have to do that no more, with mindfulness and kinds of behavioral therapy. So general anxiety disorder is the point where, the worriness they can't control, they're worried about what other people think, it can lead to panic disorder. But before we get here, there's something also called, just normal stress, right? So normal stress is normal to have, right? So, for example, sometimes I have employees that, they're late to work or something, or they're on time to work, right? Being on time to work, is a good thing, right? So regular anxiety that helps you be on time to work is healthy. When you're 2 minutes late and anxiety is so bad that you're freaking out, I'm gonna lose my job, and your stomach starts hurting, you might have IBS, that's not healthy. It's like, you're just 2 minutes late, calm down, Maybe you're in school, maybe you're a student and you get a B on your test, but your stress is so hard on your stomach that you're having pains, or it's so bad you're breaking out hives. That's not healthy. We see so many children now that are getting individualized education plans, just because of their stress and anxiety. That's not healthy that we see here. So there is healthy anxiety, just like there is healthy anger. Like me, I hated the criminal justice system so bad that I stayed the hell away from it. So realizing the difference between general anxiety disorder, healthy stress, healthy anxiety is real important when you come into therapy, and having that emotional intelligence is key in your daily life.